Welcome to GPH 726, Social and Behavioral Health. Using an ecological approach, we will consider health behaviors within the context of multiple influences on individual behaviors. The course will address the use of behavioral and social science theory to inform the development and implementation of health promotion and disease prevention interventions. My name is Charla Willis. I earned my DRPH from the University of Illinois at Chicago in Community Health Sciences. Previously, I studied at the University of California, Los Angeles to complete an MPH in International Population and Family Health and a concurrent MA in Latin American Studies. I have worked on a number of studies related to the perinatal period, including projects addressing prenatal care, breastfeeding, and gestational diabetes. My work in public health is focused on using community-based participatory research methods in Chicago, Detroit, Los Angeles, and Columbus, Ohio. Your instructor for the class will introduce her or himself in the announcements and let you know details such as their contact information and office hours. They will be guiding your section, providing additional instruction, grading assignments, and answering any questions that arise during the course. The textbook was chosen because it is very practice-oriented and offers a lot of specific examples for applying theory to health promotion. I think you will find it interesting to read and a useful reference for your future public health work. A new edition was released in 2018, so note the edition you are using. Much of the information within both versions is the same, but the new edition has several new chapters and chapter numbers have changed. You can access both versions online through the UNE library. We will be reading the whole textbook during the course. It's about 300 pages total. We will also be reading published articles that apply the theories and concepts we will be discussing each week. I encourage you to complete the readings before you watch the lectures each week. Lectures will build on the topics in the readings, but both will be important to understand the concepts you will be applying during the class. Please take time to do the readings. They're important for understanding the work that we'll be doing towards your final project, and they'll also the material in the textbook will be covered in the quiz and test. But most importantly, it's interesting information that will help you in your future public health work. Having a good understanding of theory will help you to understand health behaviors and the many influences on these behaviors, and it will help you as you develop health promotion interventions. The course objectives can be seen in the syllabus. You'll notice a list of them, but these can be grouped into two main goals. First, to understand social and behavioral theories and how these can be applied to public health promotion. Within this, we're also going to be working on how to find and synthesize evidence from the public health literature in order to inform this public health promotion. As you read through the syllabus, you will see the topics that we'll be addressing each week. During this first week, we will be setting the stage for understanding the importance of health behavior and environments on health outcomes, and how theory can help inform the design of effective health promotion interventions. We'll also be discussing searching the literature and strategies for writing. In this week, you'll have two discussions during which you will be reviewing articles. In week 2, we will discuss the socio-ecological model and learn about precede-proceed and the importance of involving the communities we work with in intervention development and promotion. In weeks 3, 4, and 5, we'll be learning about specific theories that we can apply to our work in the class and in the field. In week 6, we'll discuss intervention mapping and communication theories related to social marketing and intervention implementation. Week 7, we'll be discussing how measurement and evaluation relate to theory. And in Week 8, our focus will be on presenting proposals that are grounded in theory and evidence from the literature. 20% of your grade will be determined through 2 quizzes and 2 tests based on what you are learning through the readings and lecture. The purpose of these quizzes is to determine how well you understand the theories and concepts that will form the foundation for the rest of the class. The best way to prepare for these is to have a good understanding of the material in the textbook and additional readings. Each of the quizzes will open at the beginning of the even-numbered weeks throughout class. Pay attention to the due date for the quizzes because you will not be able to submit your quiz for grading after this time. There are 6 discussions that will make up almost half your grade. We will be working in both whole class and smaller group discussions throughout. We will talk more about the discussions in a minute. The final third of your grade will be divided among 4 assignments. These all relate to your final project. Through the discussions and assignments, you will be applying what we learned throughout the semester in our readings, lectures, and your research to the development of a theory-based health promotion intervention. The structure of this process is explained in a document located here in the first module and along the left-hand menu. Finally, the rubrics will be used to grade the discussions and assignments, and these will be helpful for you to review as you are preparing your work each week. The rubrics are also where your instructor will provide you with feedback on all of your assignments and discussions. Make sure you know how to access these to read their full feedback and see any comments they may make on the assignments themselves. Do not hesitate to contact your instructor if you have any questions. Throughout the course, much of your work will be done within groups. There are 4 groups, each addressing prevention of a specific health issue. Once you select your group, you will have the opportunity to choose a community within which you will work as you develop a theory-based intervention. This will allow your group to consider how the behavioral and environmental determinants we will be discussing will vary among the different communities and how this can influence intervention development. The majority of our work as public health professionals is conducted as part of a team, whether it be in a health department, hospital, or community-based organization. This is particularly true when working in health promotion and intervention development. The structure of this class is meant to allow you to work within a team to develop your intervention. It will be done through a combination of individual work and group discussions. Just as you would be expected to prepare before meetings and contribute substantively to discussions and the planning process in a community-based effort, you will be asked to prepare and share your work with the group each week. Then further develop your work through discussion with your team. You will find more information about the process in the first module. Each group will have no more than 5 people. You will choose your group by following the instructions in the module. As you work within your group, I encourage you to prepare your initial post and share it with your group early each week so that you will have more time for discussion as a group. Each week you will be asked to address a topic individually, then share your writings with your colleagues, and work together to address the additional questions and further the process of developing a theory-based intervention. Submitting to the discussion group late will affect your grade, as it will be difficult for you to contribute effectively if you are not engaged throughout the week. Select your group by Friday. Just a final reminder. So, we have a few strategies for success in this course. First is to complete the readings. The textbook is an important part of your readings, as are the articles, as these are going to illustrate how theories are applied in the field. Confirm due dates. We have regular Sunday and Wednesday discussion due dates as you do throughout most courses, but we also have a few Friday due dates, so make sure that you know when those are coming up, and I will give you a hint that this week is the first Friday due date that we have. Submit your work on time. There is a 10% late penalty for submitting assignments and discussions late. Discussions at the end of the discussion week will not be accepted past that end. Also, participation is a part of the grade, and if you're submitting your discussion posts late, it does not allow you to participate and your colleagues within your group to be able to respond to your work. So do make that effort to submit on time. Also, ask questions. It is an important part of learning and also helping others within your group learn. Ask questions of your instructor if you are unclear on anything. They are happy to answer and want to engage with you throughout the course. Also, ask questions of your colleagues. They have interesting insights and different experiences than you, so the group discussions are a great time to learn more from each other. In week 1, we're looking at 2 distinct topics. The first is an introduction to our textbook. We're going to be looking at health behavior and the role of theory in health promotion, getting kind of an overview of what we will be discussing this term. We're also going to be looking at finding and writing about evidence. This is going to be used throughout the course and throughout your intervention development. So there are 3 lectures and a couple readings that relate to this. This week we have 2 discussion boards. The first is a whole class discussion, and it's an evaluation of the actual causes of death article by Makdad and colleagues. This requires a post by Friday. There's no response required, but you do need to turn in your initial evaluation of this article, focusing on the writing of the article. You're going to want to post by Friday for that one, and then be prepared to post the regular group discussion, which is among your smaller group. You're going to select an article using the strategies we talk about this week to share with your group. It's going to talk about a link between the health issue and a modifiable determinant. It's going to be traditional group discussion schedule in that you will turn in your initial post to the group discussion on Sunday, and your responses are both due by Wednesday. So I just once again want to welcome you to Social and Behavioral Health. You'll find everything you need to get started in this first module.